So thank you for making the time to be here today with us. And yeah, I mean, I would also want to say a big thank you to all the people who have prepared this workshop, from staff of SMA Europe, especially Laura, Alice, Carolina, who was also involved, and Anne-Pierre, who will introduce herself later on. So as you all know, SMA Europe is an umbrella organization for patient organizations that are actually dealing with SMA. And we have many different activities, and two of our main activities are Audisma. Audisma is an initiative in which we are looking at the access to medicines and care. And also SMAcademy. SMAcademy is another initiative that we started a year ago that is actually intended to build capacity and advocates. And today's meeting or workshop is actually based on both of these initiatives. So we will be learning a bit more about how we can use an advocacy tool that's actually developed by Audisma, and SMAcademy is the frame in which we actually do the training. So I actually again say very warm welcome to all of you, and I think now you should be sharing the slides. And I hand over to Laura, who will actually guide you through the objectives of today's meeting. Thank you.
Thank you very much, Nicole, and welcome everyone also from my end to this intense workshop today. I just will give you a quick walkthrough to the objectives of today's workshop. And as you know, we had last year launched our benchmarking care for adults living with SMA benchmarking report. And yeah, why were we doing this? We have a growing importance of adults living with SMA, and with that also growing importance of adult SMA care, because current treatments extend life expectancy, they increase the adult SMA population. And yeah, we have adults constituting half of the SMA patient population. But the pediatric guidelines fail to address the adult-specific needs, for example, fatigue, kidney stones, osteoporosis, acidosis, hypertension, weight management, sexual health, and hormonal issues. That's why we were assessing and comparing adult SMA care across Europe. And yeah, the benchmarking report, you can also find it on Audisma. You can download it. It's a main report and also individual country reports. And the main report consists of three main areas. It's about organization of healthcare systems, healthcare delivery, and governmental and peer support systems. And our benchmarking report aims to highlight disparities and to identify areas for improvement when it comes to adult SMA care. Yeah, and for today's objectives, what have we planned? We want to enhance knowledge and understanding, so we gain insights into the landscape of care for adults with SMA. And we want to have a strategic implementation and advocacy skills. So we want to use the report's findings to advocate for improved adult SMA care. And we want to foster collaboration and sharing with strengthening the community's collective impact through enhanced collaboration. So, and Last but not least, we want to ensure actionable planning so we can develop concrete steps and strategies for immediate implementation post-workshop. So this workshop is also planned to be very hands-on, especially in the afternoon. We will really try to give you a hands-on way how you can use it. So it's not just a report, but really an advocacy tool you can use for your advocacy work. So, and with this, I would hand over to Pierre to introduce herself and also guide you through the agenda so you can see what's awaiting you today. Thank you.
Well, thank you, Laura. And before I just go over the agenda, I'd like to introduce myself. I recognize some friendly faces from a couple of years ago from a workshop. But so I'm Anne Pierre. I'm a patient advocate and advisor in health communication and advocacy. I am a patient myself, but not an SMA patient. So I have a lived experience of acute leukemia and bone marrow transplant. And I am mostly active either as a volunteer or as an advisor in hemato-oncology, in bone marrow transplant, and kidney disease. So I'm here supporting the SMA Europe team for this workshop in terms of advocacy, how to translate all this wealth of data generated through the report in ODISMA and to transform this into and use those advocacy tools to build your advocacy strategies. So the day starts at, well, obviously at 10, but we have the morning session, afternoon session. Morning session is sharing information with you on the content of the report. So there will be a section on key insights, looking at those 3 domains that Laura mentioned. And then we'll do a deep dive on 3 indicators, each indicator pertaining to one of these 3 areas. It says there's a coffee break, but it might just be shortened because probably a couple of minutes rather than 15 minutes. If time allows for it, we'll have more, but just to manage expectations. And so we'll have lunch break after the deep dive. I don't know why it's not moving, excuse me. And then the afternoon session. So we'll resume to our meeting to share some tips and suggestions on how to build your advocacy strategy. So a roadmap, some systematic methodology to help you build your advocacy strategies in respect to this particular topic of adult care, adult with a SMA, care, sorry, for adults with SMA. But this methodology obviously applies through across all different challenges, all different areas. Then there will be an individual work session. This is quite important that you have time to sort of think of all the topics and issues that we'll cover and try to apply that methodology to the challenges in your own country. Each of you has been assigned to work on a specific indicator and a specific call to action within that indicator. This individual work session will help you gain time and also have a bit more sort of time to think for the group session, which will focus on the exact same topic and using the same slide deck. So this is really helpful that you dedicate this time to fill those slides and think about the issues. Then there will be a coffee break, this time a real one. And then after the coffee break, we'll move to the breakout session. And this is where you will meet with other group members and share the challenges that you face with regard in your country, with regard to your designated indicator and call to action. We realize that situations could be very different and that this discussion might just show heterogeneity in practice, in experience. And this is something that you should record and and keep in mind in the discussion. For that group session, what we'd like you to do is really to focus on potential commonalities. What could be common, even though you have very different experience, what could be common strategies that you could think of and apply? So this is the focus. Try to do as much as you can. And if things are not possible, if it's really hard to agree, it's fine. Just mention it as you report. That's the second part of the afternoon. We all go back into the main plenary. So there'd be 3 breakout sessions, 3 breakout rooms. Go back to the plenary, and then you share what were the commonalities, and if not, why was it impossible to do so? What could be potential solutions? And share with the group, and actually the entire group. It could be a global brainstorming session on challenges and to find commonalities on this particular topic. And then Nicole will conclude on the day, but this is also going to be not just conclusion, but also the opportunity for questions. That doesn't mean that during the presentations that you cannot ask questions. Please, by all means, if things are a bit cryptic, either you raise your hand. Yeah, most of you are very aware of that particular function on Teams. So you raise your hands, or you ask your question in the chat. And I may not see the questions, but Alice or Laura will read the questions and then will interrupt me if, at opportune time, so that we can actually discuss your question. This is meant to be interactive. So I'm going to go over some workshop ground rules that everyone knows, but it's always good as a bit of a reminder, such as obviously the microphone, put it on mute if you don't speak. The phone, it's an obvious one, but I always forget. And when I'm at the movies and then the phone starts to ring and it's very embarrassing. It's a thing for workshops. We think it's off, but it's not always. Be on time after lunch break or coffee breaks. It's really important to be respectful of everyone's time. As I said, ask questions, either raise your hand or ask a question in the chat. Otherwise, I'll be talking all the time and it could be very boring. So do ask questions. It's not going to be boring, obviously not, but I'm just saying it will be more dynamic. So there is at some point, if we discuss and we realize it drifts too far away from the topic, I'll use the word jellyfish. I say, oh, this is a jellyfish. Doesn't mean the topic is not important. It's not interesting. It's just that it's not for today. And this, we can just keep it for another conversation, another day. And finally, if you've got technical issues, Carolina is listening to us. She's put her camera is switched off, but she's with us. So now, hi, Carolina. But for everyone else, as much as you can, try to keep your camera on. It makes it more interactive and friendly. So if you cannot, we understand there's no obligation, but by all means, if you can, that would be great. And we'll move to the icebreakers. So this is an opportunity to actually get to know each other a little bit through some questions that are completely unrelated to SMA Care. But we'd like to know, where are you joining from? So you can put your city and country. So you use your telephone, obviously, most of you know, but in case you scan, the code, the QR code, and then you have the opportunity to actually type in the place you're joining from. So city and country, or just country. Wonderful. I'll do mine too. So for now, we have mostly European. So Alice mentioned that there might be people connecting from outer Europe. So, but for now, we have mostly European, geographical Europe. Oh, we have someone from Turkey. Great. So how many, I don't know, yeah, how many voters do we have? Checking we've got everyone. North Macedonia. Well, we've got a very group. That's great. All right. Well, thank you for sharing. Now, funny question is that where would you love to live? Because we know where we are, but I'm not saying you should think of where you will retire, but you know, why not? But I personally would love to live in Portugal. But yeah, Australia, going out of Europe. That's good. In the mountains, somewhere nice and warm, so that we have someone who's very sort of open. As long as it's nice and warm, destination doesn't matter so much. Places with services, that's a good one as well. Somewhere by the beach, at the beach. Yeah, leisurely, at my home. That means you're in the right place. Patagonia, I wonder where that maybe it could be Carolina or no. Oh, okay. Mallorca, nice. Well, thank you. So we have different answers, but so it's good. We can just put them in the report summary, in the summary report, or you know, we'll have those slides. I'm trying to figure matching the initial place you live and where you want to live. And we'll do this one last. Oh no, we'll do a group picture, but before the group picture, this is a question in terms of if you had a superpower, would you prefer to be invisible or to read minds? Ooh, so we have mind readers. That's good. So I realized I actually voted for reading minds, and when actually I wanted to vote for being invisible. I don't know about you, but imagine you know every thought of people and sometimes what they think of you. I don't know if that's a good idea. But anyhow, so no, we've got people that want to have perception and insight. Thank you. Yes, great. So, as the Nicole mentioned, and a friendly reminder, the benchmarking report can be found on the Audisma website. So this is the overarching comparative report, as well as the 22 country reports. So it is a valuable supplement to Audisma, which centralizes, gathers all this data that supports advocacy, evidence-based advocacy. So this is really your tools for action. So why does this report matter and why you should own it? The report, we're all human. When we have a report, we're like, oh my God, we need to spend time reading it. And I don't know about this. But this is really investing time to gain time. You invest time up front to gain time in the long term with the insight it contains, because the report provides really comprehensive insight into the care but across Europe. It gives you a sense of where your country stands. In the report, you have call to actions and best practices. Both are useful. The call to actions allows you to focus on what needs to be done, what is priority. And the best practices can give you food for thought on activities that have been done in other countries that have been successful and that can be adapted to your own situation in your country. And it really is all about actionable steps for policy and practice changes. So it's more than facts and figures. It gives you, there is data, but also it tells you where to go, the directions to take. And today we'll talk more about the actionable steps. So the tools, more like the methodology and the nitty-gritty, the systematic approach to implement and activities that will help address those calls to action. So first, talking about methodology of this particular report. Like any report, there is always a data collection phase and analysis. So for and the sort of insight generation, this will be like the second step. In terms of data collection, there was first a rapid literature review. So, and based on the results from this literature review, an online survey was conducted for healthcare professionals and also semi-structured interviews with adult patients with SMA. With all this data, the report was drafted, but it was not drafted in silo. There was also the support of an expert advisory group made of patients, so adult patients with SMA, but also healthcare professionals and representatives of sponsors. And I'm thinking of Roche especially. So this advisory group also helped with the insight generation. So taking that data and making sure it's transformed into calls to action and actionable steps. There are methodology caveats, and that's okay, because no matter what is done, whatever reports, there are always caveats, and it's better to be transparent. The more transparent you are, the more serious you're being taken. And it's fine to say the literature review was limited, and it doesn't do any harm. There are potential disparities in survey responses from healthcare professionals within the same country. And there is a good explanation for it, is also because there is heterogeneity in practices between countries, but also within the same country, which explains why there are disparities. So the views of a healthcare professional in particular, 2-3 healthcare professionals could be very different, and there's a clear explanation for that. There are only one semi-structured interview with patient representative per country. In an ideal world, you would have many more, but it still gives good trends, excellent trends into where things are going. One aspect also is that it was done in English. Ideally, the interviews would have been done in the mother tongue, but all that said, the data collected shows some clear trends, and this is where it takes its strength from. Laura mentioned it, that the report has 3 main areas. So organization of healthcare systems, healthcare delivery, governmental and peer support. Each of these areas are split or covered in indicators. There are 19 indicators covered, and they're different from the indicators on ONDISMA. On ONDISMA, you have indicators. So this is really specific to the issue of care for adults with SMA. So 6 indicators in organization of healthcare systems, but I'm not going to list them all right now because we'll cover them in more details in further slides. Another 6 also in healthcare delivery that are really falling under this domain, this area. and another 7 indicators under governmental and peer support. In the report, when you open the report, you'll see that each indicator is structured, the way the indicator presented is structured in the same way, presented in 3 sections. You've got the key findings, the best practices, and the European comparative map, which looks like a heat map with traffic light colors going from red to green or green to red. So the key findings is really to give you an understanding of the issue, comparatively speaking, at European level. Best practices are really about sharing the successful intervention policies, programs, and this is really food for thought for your own actions. And the maps, they're really nifty and useful. You can share them with the stakeholders you interact with in person or online to show where your country stands in terms of a particular indicator. And it really helps just to call out to stakeholders, decision makers to address care gaps. So before going to key findings, I'm going to see if there are any questions. I don't know. I don't always see you when we present.
There are no raised hands and
Okay.
there are no questions in the chat.
Okay, thank you. Thank you, Karina. All right, so before I go into this section, I apologize in advance because we'll cover the 19 indicators quite rapidly. So it might be a lot of information, but it's just to really, hopefully this presentation will make you want to go and read the report in full, hopefully. So we'll first look at the organization of healthcare system, and we'll do a Mentimeter. So I'm going to move this. Because so before you actually answer the question, I'm just going to list each of them. So these are the 6 indicators that fall under organization of healthcare systems. So the transition of pediatric to adult care, the navigation through the healthcare system, access to SMA treatment centers. Number 4, this is coming in order of appearance in the report. It's not yet being prioritized. I mean, they're not in a priority order. So that's what I wanted to say. Number 4 is the network of treatment centers. So here the notion is, do treatment centers work together? Do they collaborate? Are they interconnected? The 5th indicator is about patient registries, whether they exist or not, and if they exist, how well they're structured, how is the data keying going. And the 6th indicator is about treatment guidelines for adults with SMA and standard of care. And the question here is, what do you perceive as most critical to address in your context, in your country? So the idea here is to actually decide which one is first for you, which one goes second, third, and fourth, and fifth, and sixth. And so if you scan the code, you have the option to actually reshuffle. So we have 1 voter for now. So we've got 9 voters. I'm not sure, Carolina, how many participants are connected.
We are 23.
Oh, yes. So we have more, 23, and then we can remove probably 5 of us organizing or hosting the. It's a challenge because obviously all these different indicators are important, but the notion is what would you tackle first? And what's reassuring is that we had chosen transition from pediatric to adult care, which comes first for now. So that's close second, but still good. So we've got 13 voters. Maybe we'll wait another minute and then we'll have to, unfortunately, move to the next slide. So if you could share your perception, on what's the most critical to address, that would be great.
There's a comment in the chat.
Oh, yes, yes.
That says that looking at this, it's a problem that we do not prioritize the data on patient registries.
Meaning that it should be higher up as a priority, I guess, from the comment. That's Lisbeth, right?
Yes, she has raised her
it was
hand. Yes.
Yeah, it was my comment. It just occurred to me that we might not think it's important, but it's actually important for the industry and for the decision makers when they want to have a fully perspective of how large is the group and how much money will it cost to approve treatments. So to us, it might not be important right now today. And I myself had it as a 6th on the list, but we should prioritize it. I think it was just a thought.
That's right. And I think it's in advocacy, we have all these, obviously, all these different indicators are listed in the report because they are important. Then there's the notion of where do you invest first your energy and then proceed, as you go along. But it's a very good point because the data, without data, data is at the core of everything that we're doing. That's what ODISMA is about. Data, patient registry are very important, but that's a fair point. So we have 15 voters, but we'll move on because time is running. But thank you for this. So transition from pediatric to adult care. So the key findings when you look at the report, there are 3 of them, that most countries do not have standardized national transition protocol, and that means there are inconsistencies in care. And protocols where they exist are often developed at the treatment center level, which, as I mentioned earlier, sometimes we could feel there's inconsistencies in care. That's due to that. Most countries require a reassessment of eligibility for pharmacological treatment during transition period, and this is on top of the regular reassessment, which is ongoing throughout the patient pathway. So these are the 3 key findings that you'll find in the report. And from this, the call to action that SMA Europe has chosen is really to work on developing updated or European or international adult care and treatment guidelines. This is something that would definitely help address the issues of surrounding the transition from pediatric to adult care services. Navigation in the healthcare system. The key findings are the following. So that there's mixed availability in half of the countries are in a favorable position because there are few barriers to access, but that's not the case for the other half. Adults often navigate alone in the healthcare system because there aren't that many countries with a care manager. There is an unequal access also to healthcare professionals. While it's relatively easy to have access, easier access to neurologists, there are challenges to access other healthcare professionals, especially like physiotherapists. In terms of access to treatment centers, what has been found is that about half of treatment centers do treat both children and adults, about more than half. But there is also the issue of, in some countries, of limited SMA care because they rely on general neurologists, so people that don't have any specialty in treating neuromuscular disease. So lack of those centers with those specialists. So this is something that also has been found. There is a challenge for a lot of patients in terms of accessing their treatment centers because of in some countries, the relative lack, or there are very few numbers of centers, some long distances to travel to access the centers. So the call to action here is really to prioritize funding to enable accessibility to existing treatment centers. In terms of network of treatment centers, key findings show that organized networks, they exist in about half of the countries, and that there is formal and informal cooperation between centers. And what is meant by cooperation is, for example, discussing clinical cases. One treatment center calling out for another one, saying, "Oh, well, I have a particular clinical case. I'm not sure how to go about it." So this is the type of collaboration that would take place, and it takes place in most countries. It could be cooperating on clinical guidelines, so a treatment center sharing how they do things and influencing the clinical guidelines. Another center, the training of healthcare professionals, how they collect the data, how they do research together. But there are some countries where there's absolutely no collaboration because there's only one center or none. So that's also we see a disparity in terms of how things are being organized. The call for action here is to create and/or strengthen a collaborative national network of SMA and MD adult treatment centers. Patient registry, going back to the very important point that Lisbeth made, that it is actually really important to collect the data so that we can further make our points about how care is being provided. Most countries have or are developing a registry to collect data on adults with SMA. And about 3 out of 4 countries treatment centers actually contribute to a registry, which is reassuring. So treatment centers are being compliant in that way. What is a bit more concerning is that the data entry is often voluntary. And it actually was surprising to me, coming from another patient community, is that it could be done by patient. In some countries, patients actually key in the data themselves in lieu of healthcare professionals. So the fact it's voluntary and then it's not always the same type of stakeholder doing it, it limits the utility of the data collected for clinical research. But in some countries, and to Elizabeth's point, it is key to key in the data so that it supports the prescription of the disease-modifying therapies. So in some countries, it is compulsory that healthcare professionals key in how the patients respond to the treatment, and based on that response, the treatment can be continued. In terms of call for action, here on patient registry is about reaching alignment on data collection from disease and patient registries. And the last indicator for this particular area of organization of healthcare system is about standard of care and treatment guidelines. And so what the key insights have shown is that only one country out of the 22 that were covered has tailored guidelines for adults. Most other countries rely on pediatric focused guidelines, which is an issue, as Laura pointed out, because those guidelines do not address adult-specific needs. There are gaps in treatment guidelines also being shown in the report, because half of the countries lack pharmacological treatment guidelines, while others are developing or updating them. And last, there is a mixed use of outcome measures. So outcome measures, it's going back to the patient registry topic. So outcome measures are how patients respond to the treatment. And based on that response, treatment is continued. In half of the countries, outcome measures are mandatory for disease-modifying therapies, while in others, their use is voluntary. And the call to action for standard of care treatment guidelines that relates to, that relates to this issue is the same as transition from pediatric to adult care. Is that it is really important to develop an updated European or international adult care and treatment guidelines. I'll pause here to check if there are any comment or questions. And if not, we'll move on to another Mentimeter.
There were some questions in the chat, Anne-Pierre.
Okay.
About what we mean by treatment centers. Is it just care centers, or like is it treatment centers, or is it care centers where multiple therapies maybe are administered?
I think Laura is better positioned to answer this question because I was not involved in the drafting of the report.
Yeah, actually, it is also, it differs slightly from country to country how this is managed. So this is also a point why it's so hard to compare all these countries, because the healthcare systems are organized quite differently. So we really try to focus on a broader definition of treatment center, not just focusing on medicines, on SMA medicines, but yeah, actually it's really individually structured.
I can't see the chat, so I don't know if there's another question potentially. You mentioned there are several questions, or was it just one?
There are some comments. I don't know if the people who made the comments want to bring them up, or
by all means do. If you're, let me try it. I'm trying to see if I can.
Marie-Christine has raised her hand.
Yes,
Yeah.
I just want to point that last week was an important meeting about the ERN. So it's the Network for Neuromuscular Disease. And they talk about a lot. There's half a day about transition from children to adult care. And it was very interesting. It was just a pity, but there is, in this working group, there's no SMA patient. There are some Duchenne patients, but no SMA patients. So just we cannot say there's nothing done for SMA if we are not involved in the, I think, one of the most important network where patients can have a voice, and we do not participate.
That's a good point. Being in the room, we have to enter the room. That's the issue. All right, due to time, I'll move on, but thank you for comments and questions. So this is a visual recap of the key findings. This is just more like for your information later on, if you want to help you memorize the key points of this particular section. So the calls for action, there are 4. So developing, just to sort of recap, developing those guidelines, creating or strengthening collaborative network, and then to Marie-Christine's point, making sure to be able to contribute to those networks, providing funding to enable access to treatment centers. And the 4th call to action for this particular area is to reaching alignment on data collection from disease patient registries. So now that you have learned a bit more about those different indicators in organization of healthcare system, does it change your perception on what needs to be, what is most critical to address? So if you could rank again your perception on what needs to be addressed first, based on presentation and discussions and comments. In 1 minute, that would be ideal. So I know it's a bit intense, but it'd be interesting to see if it has shifted your perception. I see patient registries just it's going up. So we had about 14 or 15 votes. So I'll once we hit that mark, we'll move to the next section on delivery of care. Oh, patient registry went down. Okay. But obviously here the notion is what needs to be addressed first. Doesn't mean that it's not important to address patient registries. So well, thank you for sharing this. That's that we'll see. We'll compare in the summary reports. We'll see if there are any differences, and maybe there aren't any. I can't recall. So now we'll move to delivery of care. So another 6 indicators. It's so this section will cover the issue of multidisciplinary care, the notion of shared decision making, the continuity of care and caregivers training, access to EMA-approved disease-modifying therapies, and access to unauthorized disease-modifying therapies. The notion here is the same as before. What do you think is the most... So sorry, it's number 4 is care team and caregivers training. So care team being a healthcare professional. So we see that multidisciplinary care is being prioritized by the group. And obviously access to medicines is really, EMA-approved medicines is key. Well, thank you for this. Unfortunately, we have to move on. So this is your perception. Oh, no, I don't want to stop anyone from voting, but time, unfortunately, is not on our side, so we'll have to keep moving. So same here. I'll go over the key indicators for the 6 indicators for this section. So multidisciplinary care key findings show that about half of the countries have formal multidisciplinary teams in treatment centers. There is, in terms of coordination, so when there is multidisciplinary teams, it's mostly neurologists that would coordinate them, but also case managers and general practitioners. Care is fragmented because access to specialists exists, but coordinated MDT support is lacking in many countries. In terms of call to action, it really is about enabling access to appropriately funded and resourced multidisciplinary care for all adults living with SMA. Then the next indicator is about shared decision making, and there are 3 key findings. That shared decision making is fully integrated in about half of the countries, but it is inconsistently offered or upon request in others. That there are tools to support informed decision making in most countries, but it varies in terms of accessibility and quality. There are other limits to patient involvement, such as strict patient involvement in the shared decision making. So as a patient, how much can you contribute to the decision making? And that includes strict constraints on pharmacological treatments, but also differences in practices among healthcare professionals. On the notion of continuity of care, key findings include the fact that there are mandatory follow-ups in about half of the countries on disease-modifying therapies, while it's voluntary in others. There are procedures in place to encourage patient engagement so that they are in charge of their own care, their self-care. So there's use of automatic scheduling and reminders in most healthcare centers to really provide that support to patients. But access challenges remain, and mentioned earlier. Because treatment centers are far and require traveling, so solutions are being put in place, such as ambulance services, video consultations between healthcare professionals and local non-specialists, so that patient doesn't have to travel to another center. On the indicator about care team and caregiving training, there is widespread but uneven healthcare professional training. So there is formal SMA training offered in most countries, but local healthcare professionals are often overlooked. So while trainings for neurologists and specialists is available, it's not so much the case for physiotherapists and nurses, for example. There is formal training for life assistants in about half of the countries. And in terms of informal caregivers, so most often family members or loved ones, the majority of countries offer no formal training opportunities for informal caregivers. On this indicator for delivery of care about access to EMA-approved treatments, the report shows that in 9 countries, adults can access nusinersen and ridisplam per the guidelines, the EMA guidelines. There are restrictions, however, on due according to age for treatment initiation. So, and these restrictions apply to 6 countries based on age. And in 3 countries, there's no access to nusinersen. In terms of access to unauthorized disease-modifying therapies, there is the concentration of clinical trials in some countries, but this is not specific to SMA. This is the same in other disease areas, and I know for a fact in oncology, it's always the same usual suspects that have the luxury to host and welcome clinical trials. So mostly Western European countries, which shows a lack of equality across countries. So this is an issue. There are early access programs available, but with restrictions for ridisplam. So it is the drug is available in most countries, but the eligibility criteria limit access. There are countries, however, where there is no access to clinical trials or to early access programs, and these are Finland, Denmark for clinical trials, and early access program would be Serbia. So the call to action regarding access to therapies, whether they're approved, authorized or unauthorized, is really to addressing inequalities in access to treatments, pharmacological treatment. And this mind map is for you to look at and use if you wish, as you want to sort of memorize. It's a visual, a visual tool to memorize all the different key issues that we've covered. So recap here again on the calls to action on delivery of care. So it is about getting appropriate, having access to appropriately funded and resourced multidisciplinary care for adults living with SMA. So it's about the fund, it's about the resources, about the training, the competencies, but also addressing inequalities in access to pharmacological treatment. So I'm asking the same question. Based on what has been shared, has your perception on what's the most critical to address changed? So if you could, based on what has been shared, rank again those different indicators. And while you do that, Laura and Alice, if there is if there is a question or comment, if you could share, that would be great.
There was a question, but it has been answered in the chat.
Okay. So far, multidisciplinary care remains as the most critical indicator to address, which is good because it will be one of the indicator for the breakouts, the individual work sessions and the breakout session as well. All right. Thank you for this. And we're almost there. Another category to review, which is governmental and peer support, and it includes 7 indicators, which are listed here. So I'll go through them. So the healthcare consultation, healthcare professional consultation reimbursement, assistive equipment and device support, social education and employment support, life assistance, professional caregivers. So meaning access to the possibility of having that particular type of support. Issues around informal caregivers, and especially in terms of training, compensation, resources provided to informal caregivers. The 6th one is about rare disease policies and public funding for patient organization. And you're already starting voting, and that's great. I don't know about you, but it's always mesmerizing to see the different bar chart moving. Well, thank you for this. So I think we have an agreement on, a clear tendency of a trend of what is the most critical to address. But again, it doesn't mean other issues are not the ones that are ranked 7. So I think 6 are not important, but they're probably not the most critical to address as of yet. So in terms of consultations reimbursement, key findings in the report show that adults with SMA receive free consultation with key specialists. So that would be, for example, pneumologists, nutritionists, orthopedists, and physiotherapists. So that's something that is reassuring. But there are co-payments that are required in some countries, and with an annual cap, which allow for free consultation thereafter. So the notion is up to a certain amount of money being total amount of co-payment. You have to pay up until you reach that cap, and beyond that, consultations are free. But there are barriers to accessing physiotherapists. So this is something that consistently sort of is being seen across areas, is the notion of accessing physiotherapists. And it's about reimbursement, but not only, because the issue is around shortages, because there are not enough physiotherapists, there are long waits. And that forced patients to seek costly private care. There are issues that are also around assistive equipment and device support. There's general support available. There are challenges, but most countries offer help with medical and mobility device. In terms of access to being able to work, there is financial aid for employers for modifying workplaces, so for adapting workplaces for adults with SMA. On the other hand, the support, the housing accessibility aid seems to be more limited. So there are few supports for acquiring or renting accessible housing. In terms of social education and employment support, the support, so disability support varies. So they're available, but often insufficient. There are some mandatory employment quotas and financial incentive for employers. They do exist, but there is variability across countries. In terms of access to education, there are financial and structural support for education, but it is limited in many regions. So going back to the indicator 14 and 15, so about assistive equipment and device support, but also social education and employment support. The call to action is to revisit the support framework for persons with disabilities to ensure it is holistic and person-centric. Life assistants and professional caregivers. Here, what the report shows is that that the funding is often insufficient for the actual hours needed in most countries. So the financial support is variable. There is limited freedom to choose your life assistant. So in half of the countries, while in the other half, they can freely choose their assistant, relying on third-party agencies. So others, yes, some can freely choose, and others, in the other half, they rely on third-party agencies. There is a workforce shortage of life assistants, and that limits the freedom of choice. So we're looking at trained life assistants with the knowledge of how to support and meaningfully provide the support to SMA patients. Informal caregiver. Well, the financial support to informal caregiver is really varied. So many countries do provide financial aid, and it takes various modalities. It could be pension contributions, paid leave, or replacement income. But that varies a lot across regions, so across countries, and also potentially within countries as well. That means there's an increase of the family burden on the family members. So when there is lack of support in some countries, it significantly impacts the well-being of both the caregivers, the family, and the patient supported. While countries allow informal caregivers to be hired as life assistants, others restrict or prohibit this practice. So the eligibility to work as life assistant is challenging. So here the call to action in terms of whether it's life assistant, whether the professional or informal caregivers, it really is to address insufficiencies in formal and informal assistance. And we have another 2 indicators to go, so 18 and 19. And 18, the indicator 18 is about rare disease policies and public funding for patient organizations. So there is limited inclusion of patient organizations in rare disease plans. So around half of the country I meant there's real inclusion of SMA in the rare disease plan. And the involvement of patient organization is another key finding. So around half of the countries have rare disease plans, but they don't often prioritize neuromuscular disease or SMA. There is lack of public funding. Most SMA organizations rely heavily on private donations and pharmaceutical funding as a result. And then the third point, as I mentioned, in terms of the direct involvement of patient organization in the rare disease plan, there are countries like France or Serbia where organizations play a direct role in the development of these strategies. But that's just not the majority of countries, obviously. And finally, before the last indicator, the call to action. What have I done? Yes, this is. Let's move to the next indicator. Patients' organization support. So nearly all countries have at least one patient groups or more supporting SMA patients. In most countries, patient groups prioritize support for adults. And in terms of key roles, obviously, while it's preaching to the converted, because some of you are patient advocates now included in patient organizations, but I assume large majority actually are part of a patient organization. But it is really about facilitating peer-to-peer support, assisting adults in accessing healthcare services, and disseminating SMA-related information. Here, there's a mind map again to help you sort of memorize the key issues, the key indicators listed in the report for this particular area. And this is for use for later on. So the call to action is really about revisiting the support framework for persons with disabilities to ensure it's holistic and person-centric, and addressing insufficiencies in formal and informal assistance. And before we take a 5-minute break, well, let's just 3-minute break to grab a cup of tea. Maybe we can just conclude on the key insights and see if your perception has changed following presenting these insights to you. What is, according to you, the most critical indicator to address? Hello. This is intense for everyone. I hope everyone got a chance to have a refill. I know it was short, but as Alice mentioned, it's not too long to, lunch break is at noon, so it's another 40 minutes to go. I will get starting, so on the in-depth analysis. So what has been reassuring is I don't know if the prior choice that had been done on the indicator for in-depth analysis and for the work session has influenced your vote, but definitely the transition from pediatric to adult care services, was prioritized quite high, same as multidisciplinary care and life assistance. So I will go over these 3 indicators and sharing with you the information, how information in the report is structured. And I'm trying to go to the next slide, and I don't know why oh, there you go. Excuse me. I'm going back. So you know that slide already, you no need to go over it. But as I mentioned, each of the indicators is structured in 3 sections. The first one is key findings, and then the second one is the European comparative map, and the third one are the best practices. So the European comparative map, it's also called a heat map, and it's using the traffic light sort of system, going from good to poor. And how these maps have been done, they've been the ratings has been done according to 2 criteria. The first one is the existence and implementation of transition care protocols and policy. And the second one is the need for requalification for access to pharmacological treatment. And so focusing on the first one, so for this particular criteria, then there was a score given for each country. So was the execution and implementation of protocol, was it good, reasonable, not good, or poor? So these are the scores that were mentioned. Oh yeah, good. So Netherlands was the one that was really good. So it was an adequate implementation of national transition protocols. But then other countries got a score 3. So there is a national protocol exists, but the implementation is not, is a bit inconsistent. So the additional visuals to this map is just for this presentation, but in the report itself, you will have the heat map without those sort of pointers to show you how things are being rated. Other countries got a score 2 because the implementation, in terms of like the quality, in terms of the how the implementation was done, and in terms of the quality of that implementation. And then some countries got a score 1 because there were no transition protocols, total absence of. In terms of the need for requalification of access to pharmacological treatment, then this is how the score, are being done. If it's not needed, you get a score 4. And then if it's needed and there's administrative burden for the patient, then it's a score 2. So the ones that there's no real need for requalification, these are the countries with the cross, the green cross. So you see them listed. And then in terms of, for the sake of time and providing an overview, countries that got either a score 3 or 2 are the following ones. So you've got those two criteria, there's 2 indicators, these are like sub indicators. Each get a score, and then those 2 score combines give you a composite value, which would be reasonable, for example, for France, when you see, for example, there's a need for requalification, but there is, transition protocol, which are inconsistent, but still. So this is how you get those different scoring, looking at 2 sub-indicators. I'm not going to go through that process for the other ones, but just that the whole methodology is in the report. So the colors are not random. They're really based on the scoring of each sub-indicators. Then there is the best practice section, which has some really interesting, as I said, food for thought for similar initiatives in your country. So looking at Poland and Denmark, for example, for this particular issue of transition from pediatric to adult care services, what we see is that in Poland, they have an ombudsman. I can't say it properly. I think this is Swedish name initially. But this is a legal representative, often appointed by a government or organization to investigate complaints made by individuals. So in Poland, they have that, which is an advantage. And if you do have an ombudsman, in your country, maybe you should partner with them, reach out to them to relay your complaints about specific issues. And if this role does not exist, maybe advocating for the creation of an ombudsman. I can't say, I'm sorry. And I know this is probably a very long-term activity because it would take time. But yes, the low-hanging fruit is for countries when there is already one. And maybe this is just a new partner. This is a new stakeholder to reach out to. Some stakeholder you may have not thought of initially. In Denmark, one best practice in Denmark is that the pediatric neurologist typically attends the first adult care meeting. So they're really there to relay, to pass on the baton to the other neurologist, to the adult care neurologist. So this is something to sort of flag to your stakeholders and to advocate for similar practices in your country for continuity of care, if that does not formally already exist in your country. I'll pause here to see if there are questions, because I can't see the chat or comments.
There are some comments that ombudsman is originally Danish.
And, apologies. Yeah, I thought it was Swedish, but.
And in Russia, they do have this institution, but it's separate for kids and adults, so it doesn't help.
Okay. Well, thank you. So this is what I shared, like it was in the overall, like the comparative report, but there's also a wealth of information in the national country reports. So here I took extracts from the Polish and Danish reports, but you're welcome to actually look in more details of for each indicator, how they are rated and more details about the best practices in those countries. So similar logic for multidisciplinary care. We've already talked about the key findings. And then there is the European comparative map, so the heat map. And here you have one indicator that for which scores were given to fill this map. So these are the scores. You'll have time to read them, I mean, when you look at the report, but this is just to give you a sense of the scoring, where score 4 is multidisciplinary teams are in general available. Healthcare professionals are usually based in the same treatment center and they meet to discuss care. And in opposite, score 1, MDTs are in general not available and patients do not have access to the different specialists they may need. So the scoring has been done that way. And being familiar with what the colors correspond to is really important when you reach out to stakeholders, member of parliaments or representative of various ministries, because they will ask you, what does good mean? What does that exactly entail? So make sure you know what the scores correspond to in terms of like a sentence. This description of what good or not good is. So the best practices in terms of multidisciplinary care, Belgium and France have been flagged as good practices. So let's look at Belgium. So in Belgium, MDTs are present in all NMD reference centers. So here, looking at this, the idea is to promote the set of comprehensive and integrated care models to be a standardized part of patient care. And also in Belgium, on occasions, there are additional specialists like dermatologists may be also part of the team. So that is actually shows a sense of like flexibility and maybe, pushing for a flexible care model, because this is less, I would say, it would be perceived as less of a constraint when you push for these integrated care model to be put in place, so that you don't get too much pushback from center managers, directors of centers, or even healthcare professionals saying, could we have a flexible care model? And then once that is in place and they see the benefit for themselves and for patients, then things can get more institutionalized. In France, there are formal meetings, so to coordinate care. And so here, really, the key takeaway is to encourage the establishment of such regular and formal meetings so that things are really structured. Also, in France, the team is supervised by a designated GP, which is formally acting as attending physician. So here the key takeaway is to advocate for a central coordinating physician. And again, here, upon request, nutritionists may also be included in the team. So what seems to be working well in those two countries is to push for flexible care models. Again, do not forget the country reports, which has more details and provides more insight to complement the comparative report. I'll pause here to see if there are any questions because I can't see the chat or comments. And the speed at which I'm moving, maybe we'll have more time to at the end to discuss, because I realize it's a lot of information and I tend to speak fast, and I apologize if I do. So the third indicator is about that we want to do an in-depth analysis and a deep dive this afternoon in the individual work sessions and in group sessions. So it's life assistants and professional caregivers. We've gone over the key findings, which are, to be found in the report. Also, you have a comparative map, so a heat map, and two indicators are used to come up with the composite value of good, reasonable, not good, poor, or no information available. So those two sub-indicators are financial support for hiring a life assistant, professional caregivers, and the other one is ability for adults to select their life assistant and professional caregivers. So for each day is a score from 1 to 4, 4 being the best. So one or more life assistants can be hired at no cost, full reimbursement. And the opposite situation is that there's no financial support for hiring a life assistant. And then the second criteria has also its own score. So score 4 here is adult living with SMA can choose whether to directly hire the life assistant or to partner with organizations that facilitate this for them. And I see Lisbeth has a question, and then I'll give you just after this sentence. So then the score 1 is the total opposite. So they need to rely on third-party organizations to facilitate this for them. So they have no say on who their life assistants will be. Yes, Lisbeth, you had a question.
Well, it's more a comment.
Yes.
I see that Denmark is green. It's true you can hire life assistants with full reimbursement, but you have to get approval to hire them at first, and the approval is getting increasingly hard to get, and people under 25 as a general rule doesn't get it anymore. So I would say Denmark should be orange.
Okay.
It's really moving in the wrong direction for life assistants in Denmark, because the law says that if you have it, you will get a full reimbursement, but if you're not allowed to take on, then you can't use. Yeah.
So the approval process is is becoming more restrictive than it used to be, you would say?
Yes. Yeah, very.
But things keep moving, and obviously the report and all the insights. I believe, Laura, correct me if I'm wrong, the report was finalized last year, it was in 2024. The data collection.
That's true.
Yes.
So yeah,
Yes, so things
we
keep
always
moving. Yeah.
we need to keep in mind that things might have changed for some countries in the meanwhile.
Yeah.
So yeah.
So in terms of best practices, here it's Sweden and Portugal that have been sort of have the limelight for them to share best practices. So in Sweden, there is compensation from the social insurance agency. So if it does exist in Sweden, if it's possible in Sweden, why not in your country? And flag this to stakeholders that in the European Union, why is it that in Sweden they have a compensation system and in my country we do not have that similar system? So adults with SMA have the choice of either directly hiring the life assistant or enlisting the service of an organizer. So we should push for the flexibility in service provision. Municipalities are responsible for arranging support services. So really it's about encouraging local governments to take responsibility for providing support services for those with lesser care needs. So trying to see which stakeholders can just become involved and take charge for subgroups of the community that have no access otherwise or no possibility otherwise. In Portugal, they conducted a pilot project called MAVI, and this worked really well. So the notion of pilot projects is actually quite good when you interact with decision makers, because a pilot project is meant to be transitory and it's less threatening to, I would say, or less, it's an indication of lesser commitment. It's not permanent. So already propose pilot projects because it's a risk managed way to demonstrate the effectiveness of new care models. And then when the pilot, if the pilot is successful, you use that success to push for their integration in a long-term national disability and health strategies. And also advocating, in Portugal, they have specific training for life assistants. All of them undergo specific training. So with that knowledge, advocate for regulation or standards that ensure life assistants are well trained in your country. Then more insights again in country reports. These are all available for you to get the insights from.